How to stop hair loss. If you subscribe and like the video before you start watching it, you will give a great support to my development. Thank you very much. Following a Mediterranean diet. A 2017 study in Archives of Dermatological Research found an association between the herbs and vegetables in the Mediterranean diet and a decreased risk of androgenetic alopecia, or pattern baldness, in males. Avoiding crash diets. Very low-calorie diets can deprive the body of essential nutrients, including those necessary for healthy hair, such as protein, fatty acids, and zinc. Crash diets do not usually result trusted source in permanent weight loss. According to a 2019 review of literature trusted source, hair loss can occur in people who lose body cell mass as the result of weight loss from a low-calorie diet. This can result in temporary hair loss. Supplements and medications. Some supplements and treatments may help prevent or reduce hair loss. Taking multivitamin supplements. Studies dating back several years suggest vitamins help prevent hair loss. A 2019 review in Dermatology and Therapy trusted source examined the role of various vitamins and minerals in preventing hair loss. The role of vitamins and minerals in hair loss remains unclear. However, vitamin deficiencies may be a risk factor for hair loss. Some vitamins and minerals that may help include 1. Selenium. 2. Vitamin B. 3. Zinc. 4. Vitamin D. 5. Iron. 6. Vitamin A. 7. Vitamin C. 8. Vitamin E. Anyone considering taking a multivitamin supplement should talk to a doctor first. The best products contain all or most of the recommended daily amounts of each vitamin and mineral in a single dose. However, the Food and Drug Administration, FDA trusted source, does not regulate dietary supplements in the same way as they do medications. Third-party companies, such as NSF, USP, Consumer Lab, or Banned Substances Control Group, BSCG, can analyze supplements for quality and provide a certificate of analysis, COA. However, supplements do not require third-party vetting to be sold to the public. A person may want to choose dietary supplements that have been vetted by a third-party company. Taking hair loss medication. Several medications for preventing hair loss are available. According to a 2019 review of Studies Trusted Source, minoxidil, applied topically, is the go-to treatment for androgenetic alopecia in both men and women. Minoxidil is the active ingredient in Rogaine, which is available over-the-counter, OTC. The review suggests that doctors sometimes use minoxidil for treating other causes of hair loss, such as from chemotherapy. The authors of the review state that more research into minoxidil could be beneficial. The prescription drug finasteride, Propecia, is another medication for hair loss on the scalp. It can be taken orally or applied topically. A 2021 clinical trial trusted source found that a topical finasteride spray solution significantly improved the hair count of 323 males with pattern baldness. Tips for healthier hair. Certain practices and products may contribute to healthier hair and prevent hair loss. These can include massaging the scalp. A small 2016 study of 9 healthy men found that a daily 4-minute trusted source scalp massage stimulated hair growth. These findings are promising. But researchers will need to study larger samples to determine whether scalp massages are helpful for hair loss. Trying low-level laser light therapy. Low-level laser light therapy, LLT, also known as red light therapy, is a treatment for skin issues that uses low-wavelength red light to stimulate cell growth. According to a small 2020 controlled trial in Korea, after 16 weeks, LLT significantly increased hair density and thickness in 48 people with androgenetic alopecia. Researchers need to conduct additional research to determine the proper wavelengths and duration of treatment. Using coconut oil for damaged hair. A study in 2018 found that coconut oil may help to prevent hair loss due to ultraviolet light damage or grooming habits. However, further research is necessary to confirm this. Applying coconut oil to the scalp could strengthen hair and avoid loss from damage. Using essential oils. Applying certain essential oils to the scalp may boost hair growth. A small 2021 study trusted source found that pumpkin seed oil, applied topically to the scalp for 3 months, significantly increased hair regrowth in people with female pattern baldness. Rosemary oil applied to the scalp may be as effective as minoxidil, according to a 2015 randomized controlled trial trusted source. In a 2020 study trusted source of people with central centrifugal cicatricial alopecia, CCCA, a type of scarring hair loss experienced by women of African descent, the following were among the essential oils that showed promise for increasing hair growth. 1. Jojoba oil. 2. Lavender oil. 3. Peppermint oil. 4. Tea tree oil. Researchers still need to conduct larger studies into the effects of essential oils on hair growth to determine their effectiveness for other causes of hair loss. Using caffeine-infused products. Caffeine in topical formulations such as shampoo and conditioner may prevent hair loss as effectively as minoxidil, according to a 2020 review. Caffeine stimulates metabolism and the proliferation of cells. Applying antioxidants to the scalp. Using shampoo or scalp treatments that contain antioxidants may decrease hair loss and improve the health of the scalp. Women who used either a shampoo or leave-in scalp treatment containing the antioxidant pyroxatolamine for an 8-week period had increased hair growth and more improved scalp conditions than women who used placebo products, according to a 2021 clinical trial trusted source. Protecting hair while sleeping. A silk or satin pillowcase can help prevent hair breakage caused by friction, tangling, and tugging. Going to sleep with wet hair may weaken the strands and may cause breakage. When hair is wet, it is in a vulnerable state. Maintaining good hair and scalp care. Taking proper care of the hair and scalp can help prevent hair loss. It may also improve hair growth. Keeping the scalp and hair clean may also prevent hair damage and loss. The American Academy of Dermatology Association, AAD, recommends gently massaging the shampoo into the scalp but not into the hair. The association also recommends using conditioner after every shampoo. The AAD states that wearing tight hairstyles such as ponytails, buns, or cornrows can damage hair and recommends loose hairstyles that do not pull on the hair. According to a 2015 review trusted source, certain medicated shampoos and conditioners could prevent hair loss. Avoiding harsh treatments, such as heat, curling, and dyes, may also help.